away from me.
Oh, he's in his
Oh,
hand.
Josh.
Do you want me to grab
Get
everybody?
the people up here, so we need Alita.
I would between people turn off.
Anywhere, so just grab a seat. Good morning, everybody. We're going to get started if everyone would like to have a seat.
What do you learn?
So impressed and grateful to see how many people have come out today. So this is an exciting day for us in so many ways. We've waited, I think, since 1998. So we are grateful to have all you here, and we're grateful that God has blessed us with a little break in the weather. So I just want to thank everyone for being here to celebrate the groundbreaking. It's always meaningful when a community comes together, but today is especially significant for us because what we're building is way more than a structure. We're building access, stability, and opportunity for better health. Primary care is the foundation of a strong healthcare system. It is where prevention happens, where chronic conditions are managed before they become a crisis, where patients build long-term relationships with providers who know their history, their needs, and their goals. When primary care is strong, everything else in healthcare works better. Emergency rooms are less strained, hospitalizations decrease, but most importantly, people live healthier lives. So you're just going to have to. For our community, this clinic represents improved access at a time when access matters most. Many of the people we serve face barriers, distance, transportation, insurance challenges, or simply limited availability to providers. This facility is designed to reduce those barriers and bring care closer to home. It's also designed to be welcoming, efficient, and patient-centered so that people feel respected and supported from the moment they walk through the door. I would like to take a moment to recognize and sincerely thank everyone who's made this project possible. No meaningful accomplishment is ever achieved alone. This project is the result of the support, guidance, hard work, and encouragement of many people. To our team members, mentors, partners, and supporters, your dedication, patience, and belief in this vision helped turn this idea into a reality. I am deeply grateful for the time, energy, commitment each of you have contributed along the way. I want to extend my deepest gratitude to the William N. Pennington Foundation. Their extraordinary generosity and steadfast support made this project possible. Without their investment in the health and future of this community, this clinic would not be possible. Their commitment reflects a belief in rural healthcare, in access, and in the idea that where you live should not determine the quality of care you receive. I also want to recognize that the funding for this project is made possible through the United States Department of Agriculture. The USDA, their support has been instrumental in bringing this vision to life. Their investment in rural infrastructure and healthcare access reflects a continued commitment to strengthening communities like ours and ensuring essential services are available where they're needed most. This project represents partnership. A project like this does not happen because of one organization alone. It happens because of collaboration between healthcare leaders, community partners, construction teams, designers, funding agencies, and staff who believe in the mission enough to carry forward every step of planning and preparation. I want to acknowledge our design team, CTA, Tracy, as well as Miles Construction and all of the subcontractors involved for their work in getting us to this milestone. I also want to recognize our county leaders, our clinical teams, and everyone who has contributed ideas, time, and problem solving to bring us here today. We also recognize that breaking ground is not the finish line, it's the beginning. From today forward, there will be months of construction, coordination, and continued planning to ensure that what we build is safe, efficient, and sustainable. But each shovel of dirt today represents progress toward a future where care is more accessible and more connected. Most importantly, the clinic is about people. It's about the people who will no longer delay care because the drive is too far. It's about the parent who can bring their child in for a same-day appointment instead of waiting for an emergency visit. It's also about the older adult who can manage chronic conditions with consistent follow-up instead of crisis care. These are the real outcomes that we're working for today. As we break ground today, we are making a commitment to our patients, our staff, and to our community that we will continue building a healthcare system that meets people where they live. Our first speaker, I am very honored and proud to introduce, is the United States Rural Department Nevada State Director, longtime resident, Alida Savalas. Alida brings extensive leadership and political experience to her role as the State Director of USDA. Please join me in welcoming Alida.
Thank you. Greetings and salutations. My name is Alida Ceballos, and I'm the State Director. For Rural Development, you may not have heard of us, but if you live in rural Nevada, there's a good chance you've drank our water, been to a business we funded, gone to a hospital that we supported, because we are the 7th largest lender in the United States. I just want to say a big thank you to our community facilities team. We plan projects that last decades, that last centuries. We think a little bit different than your average bank because we are investing in the soul of rural communities. And the Trump-Vance administration has prioritized investments into rural Nevada. We are delivering every day, and this is part of that delivery in making sure that federal dollars are invested into the communities that need them the most. You may have heard about the Rural Health Transformation Funds from the One Big Beautiful Bill. Or maybe you didn't. Maybe it's only us political hacks that heard about it. But Nevada was awarded $180 million as part of the Rural Health Transformation Funds. And Health and Human Services can't build hospitals. We can. So we partner with other federal agencies to make sure that that $180 million is delivered and invested into rural Nevada. Agriculture, a lot of people think U.S. Department of Agriculture, they think soil. Here at Rural Development, we work on the soul of our rural communities and make sure that they are invested into and have the prosperity and the growth path they need to grow for decades to come. So thank you for having us. And I would like to bring up a little check. We have funded over $2.7 million into this project, and I won't read the whole number because it's too big, but want to thank you and present this check on behalf of President Trump and Secretary Rollins to the South Lyon Hospital District.
Wow. Wow. Try to catch that thing.
Our next speaker is Ronnie Cooley. Ronnie is the chairman of our hospital district. So, Ronnie.
Good morning, everyone. Thanks for coming. First of all, I'd like to introduce the other members of our hospital district board. I have Joanne Lawson, who's also president of the governing board. You'll meet her in a few minutes. We have Susan Cottingham, our vice president, James Christensen, our treasurer. We also have a vacant seat currently on our board, which will be filled with the upcoming general election. So we're excited about that. So I've served on this district board for about 8 years now, and I've seen Tony struggle through many difficult situations, but never with the relentless attitude she had toward this project. Through it all, she never gave up, even though we had doubts many times that this project would never happen. She had full support of both boards, and she pushed her way through all the difficult times, and here we are today, breaking ground on this beautiful new clinic. So thank you, Tony, for not giving up. This clinic not only provides more up-to-date facilities for our providers, clinic employees, and patients, it also provides opportunity to encourage specialty doctors and providers from outside the surrounding areas to maybe come here and see patients who have difficulty traveling outside the area and need specialty care. We're really looking forward to that. So a big thank you to all the folks that have been involved with this project. Obviously, without that, this would never have happened. So again, thank you all for being here and for all your support along this way. And have a great day.
Thank you, Ronnie. I am now very grateful to introduce the chairman of our operating board. So Joanne Lawson.
Good morning, and thank you all for being here today as we celebrate the groundbreaking of our new rural health clinic. This has been a dream for many, many years, even decades. That it is finally coming to fruition is so exciting for South Lyon Medical Center, our providers, and especially for our community. Tony and Sarah, our CEO, has poured her heart and soul into this project, and we thank her. I would like to also thank the Pennington Foundation, USDA Rural Development, Battleborn Medevac, Miles Construction, Zions Bank, among others, for helping us make this a reality. We couldn't have made this happen without all of your assistance. We are truly grateful. We look forward to saying goodbye to our modular building in our parking lot, sitting over there. So let's get this new provider clinic built. Again, thank you for being here.
One of our newest partners, Battleborn Rural Medevac, has been with us for several years, and I am proud they have been generous donors to our project to see it fruition as well. Gage Locke is a flight nurse and our base manager.
Thanks, Tony. So as you said, I'm Gage. I'm a flight nurse and base manager of the Battleborn Medevac Yerington branch. Since our first flight in June of 2024, we've been welcomed with real warm, open arms to this community. We're really lucky to be here. It's been awesome to see the growth of Yerington and all the other little communities around here. We're just grateful to be here and honored. The strength out here is impressive with the hospital crew, fire department. Everyone's been really great, and we appreciate you letting us be a part of your community. We're just doing our part to try and support you in whatever way we can. It's really great to see the growth that we've all been through in the last couple of years, and we're just excited to see more and help you guys get there.
Now it's with great honor that we have had a relationship with our design team, CTA, for probably 30 years. They have been part of, we haven't had the opportunities to build a lot, but they're one of the leaders in hospital and healthcare. So Tracy Baker is our architect engineer from CTA.
Well, good morning, everyone, and thank you all for being here today. On behalf behalf of CTA, I'm proud to celebrate our long-term relationship with South Lyon Medical Center in this pivotal moment. The groundbreaking for a modern, efficient clinic that will serve this community for years to come. When Tony reached out with a clear need to build a clinic that meets the needs of Yerington, Mason Valley, and beyond, we were excited to get to work. From the very start, our goal was simple: design a facility that feels like it belongs here, that honors the existing hospital identity, and that supports excellent patient care every day. Our design process always leaned into those goals. This will be a modern hospital clinic rooted in the spirit of this agricultural community. The building will serve as a welcoming feature at the hospital campus entrance from Bridge Street, with site elements that help define the campus and create a clear, safe arrival for patients and visitors. Thoughtful wayfinding and traffic calming strategies are integrated into the plan to improve pedestrian flow and make the campus safer and more accommodating for patients, families, and staff. None of this design came from a single mind. Working together with South Lyon team, we met frequently with hospital staff to truly understand the people who will work in this clinic every day and the patients they care for. Those conversations shaped how the spaces are organized, from efficient clinical layouts to workflows that reduce staff strain and improve patient throughput. We leaned into the patient experience at every turn, prioritizing accessibility and safety so that every visit is dignified and straightforward. We also collaborated closely on a design palette that embraces the local environment. We incorporated materials, colors, and textures inspired by the surrounding landscape and committed to modern building systems to ensure comfortable interior in all seasons. The result will be a clinic that combines practical function with a welcoming, human-centered atmosphere. This project represents more than a new building. It's an investment in health, dignity, and the future of this community. This will be the product of partnership between CTA and South Lyon Medical Center, between clinicians and designers, and between the hospital and its community who made their voices heard. Thank you to Tony, to the hospital leadership and staff, to Miles Construction, and to everyone who has contributed time, expertise, and support. We are honored to be part of this work, and we look forward to seeing this clinic come to life. Now let's break ground together and begin building a healthier future for Yerington.
The next, I feel like Miles Construction has been part of our family for quite a while. Miles has helped us with work on Barnett Clinic. They've helped us redo our Dr. Mary Wing, and I'm excited to see that they will now be overseeing the construction of our clinic. I'm proud to introduce Carrie, the president of Miles.
Good morning. As a contractor, a builder, a creator of things, I'm so thankful to be a part of this, to be a part of having such a positive impact on this community, to be a part of touching people's lives in such a positive way for so many years to come. It takes an individual, a local, a regional, a state, and a national effort to make this happen, which also makes me thankful that I don't have Tony's job. I just have to build this. Thank you all for being here today to help us start that process. Let's go build it. Thank you.
So there's no better way to end our program than with an individual who has pioneered rural healthcare through her dedication to serving the residents of our hospital district, and now through her continued commitment to all the residents of Nevada. Please welcome Senator Robin Titus.
Well, first and foremost, thank you, Tony, for asking me, and I'm quite impressed with the number of people that are here. I've also learned with all the outdoor speaking that I've done, I don't bring paper anymore because it just freaking blows away. And Tony really addressed what I wanted to talk about, and that's really the community effort that this took. And she only invites me to these things because I have this history in my background. I've been here a long time, and so I've seen all the different changes, and maybe that means I'm getting older, but we're getting older together, and Tony, that's for sure. When I first started practice, this is how healthcare has evolved. I came back to practice here in Smith Valley and in Mason Valley in 1984. I went to Dr. Mary, who had delivered my mother and many citizens in both these communities, and Dr. Mary Fulston, and I went to her office, and she had it in her home. And I said, Dr. Mary, can I have your records? And her assistant went down into her basement, and she brought up one box of records after a career of 50 years of seeing patients. Literally one box. And things have truly evolved. And she had her office in her home. I had my office in my home. And she had an office here, and I had an office here, as did many physicians prior to us having it in our home. And I see Dr. Orko here, and to have it in his home would be a hard risk when he has his little boys running around. And HIPAA laws, when I had it in my home, I'd see a patient come in, and they'd sit in my office at home. I've been in for 42 years, and there was really an issue with HIPAA violation, because the patient would sit there and tell a problem, and then another patient would be there, and suddenly that patient had an appendicitis, and it got on the chain, and the call, God bless them, they would call around and pray for this person, but it turned out that, it wasn't appendicitis or anything, but there was never anything private in that office. And so things have truly evolved, and building a modern clinic is really important. But again, as somebody has already said, that it couldn't happen without group effort in this community. And I want to acknowledge that Ms. Alita is here, and I've known her for a long, long time. When this administration started, they made promises to rural America. She is the rural representative. We chat a lot about things going on, and it's just not political fodder. It's real. The money's real, and it's coming to rural Nevada, and this clinic is evident of that. Regardless of what you read, regardless of any political pundit, what they might say, the proof is in the check that has come our way and the fact that we can build grounds today. Additionally, the Pennington Foundation. I was telling the folks representing the Pennington Foundation, I started medical school a long, long time ago. Actually, in 1977, I was in the second 4-year graduating class at the University of Nevada School of Medicine, the University of Nevada School of Medicine. Now we have 2 schools. But at the time, if it wasn't for the Pennington Foundation, we would not have the building and the stuff we needed for us as med students to move forward. And then look at our 2 boards. When I started, we didn't have 2 boards at this hospital, but we needed to survive, and we went through a lot of iterations of what that would look like from other hospitals trying to run this hospital. It always failed, and then the decision was made for the taxpayers, and that's the key. So this is also a taxpayer-based foundation. So everybody out here who pays taxes in Lyon County helps support this hospital. And then we're look at from the supporting board, the operating board, and then the construction people who are really even to build out here, Miles Construction, to the architects. This is a community project, but at so many layers. But that's what Nevada does. That's what we do. I see people out there that I took care of as kids. They were kids when I saw them, and now they're firemen, and now they're part of our community and represent us. That's truly a community effort. From the top down, from the nation down, from the state to the county, the local government. We can't do that without everybody being here. And yeah, I'm the old person in the room, and I have that history, and I got that one box, but you can't practice medicine out of a single box now. So the need for a more modern facility has transpired where all the technology, we used to have many specialists come, but when we lost part of our clinic and that we had to have expansion to see patients in it, these specialists wouldn't come here anymore. And so the key to keeping patients in the community is bringing those specialists here. They're willing, and with a modern facility, we hope to see that come to fruition. So I thank you all for being here today. I think Tony, I'll continue to be the old person in the room and give history lessons for everybody, because I'm proud to do this. Because again, I'm proud of our community and what we got done. So thank you all of you, for being here today.
Thank you, Senator Titus. And I don't know if she's the oldest person in the room, but as we wrap this up, I want to thank you to everyone who made this project possible, and thank you for being here to share this moment. Now, let's turn the soil and officially begin the work of building this clinic and strengthening care for our community. Let's build a clinic.
We're gonna go shovel dirt.
If you guys want to, we can put them on next. We have a lot of dirt.
So all the speakers are turning on.
She gets resources off the track.
We're rounding them up.
Okay, great. So we can have you guys go. I have you do a couple of
You count it down.
Move some dirt.
Yeah, move some dirt.
1, 2, 3. Okay. That looks great. You got what you need.
Hats.
So you're next.
Yes.
You want to... Ready? 1, 2, 3. Awesome. One more. Ready? 1, 2, 3. Woo. All right.
Okay, I am going to have all of my clinic staff come up, and I'd love to have them in the picture. They will be actually living in the clinic when it's done. So, Celeste.
Will everybody grab a shovel?
You guys are going to have to get this shorter people.
We're ready to put them away. Everybody grab a shovel. Okay, back. There's some shovels. There's 2 more shovels. There's 1 more shovel. There's 1 more shovel. Come grab it. What?
I didn't know we had this many people in Yerington. No, I knew that.
Well, they're all here.
That's right, we're all here.
That's a great photo. Oh, do we have a shovel? Okay. We need to do that again. Let's do that again. That's really long. All right. Ready? 1, 2, 3. Okay, one more and we'll do this way. Shoveling again? I mean, like your side. One, 2,
give me credibility.
Well, when I was out, you want some coffee, Jim?
Oh, that's not
What a tiny little. He said I've never been so